Good afternoon to everybody and welcome to this new debriefing. Today I have the pleasure of receiving somebody I have invited many times, Dr. Peter Mccullough from the United States. Good afternoon, Peter.
Thanks for having me.
Yes, today we're going to cover three main topics. One of them is you've published with Professor Raoult, a French professor in France, in a peer-reviewed sort of magazine. You've published a new study on the results of the IHU, which is the Mediterranean Health Institute in France, that demonstrate the efficacy of early treatment. And I thought it would be very interesting because you're one of the co-authors, you co-signed this paper, for you to comment really the results and basically also tell us what you think is going to be the consequences, because in France there is a lot of noise around it.
We looked at the data very carefully, and many congratulations to the French team, very much heroes for the world. And this is what's called a real world study. That is what happened. So it's different than a randomized trial. A real world study, what really matters is patients surviving. So in the end, the patients with the best survival win. And what Raoult and the French team showed convincingly is those at high risk who received hydroxychloroquine and azithromycin, they survived. They survived better than all the groups. And they had a lot of different gradations in terms of, fully treated, partially treated, not treated at all. Another important observation is that even those very elderly senior patients who were treated early at home and became hospitalized, they were more likely to survive the hospital. So this is very important, that even though it's not a randomized trial, it's a real world confirmation that the combination of hydroxychloroquine and azithromycin was not only safe, but it was very effective in keeping people out of the hospital and alive. And even if someone was hospitalized, they were more likely to survive. It matches our experience here in the United States. It matches a very large Iranian study that was done now several years ago. Same thing. They had treated about 25% of their adults. It was another huge study, over 20,000 individuals. So in aggregate, we now have a compelling case that hydroxychloroquine really is a choice as the base of standard of care in high-risk COVID-19.